I am pretty certain that the timing of Cyril Ramaphosa's signing of the NHI bill into law today and the way it was done, because a couple of days ago, last week, he assented to the hate speech bill. It's got a more fancy title than that, but he simply put out a statement saying the bill had been signed into law. But today there was a whole ceremony broadcast live on all of the national news channels and much palaver made of it. And it's very, very seldom. I can't recall the last time that a bill was signed into law in this very public fashion. So as far as I'm concerned, it's absolutely party political, election timing related. We chat now to Professor Terrence Kommal, a professor at Northwest University and CEO of something called Medical Expert Consulting, who joins us now via Zoom. Hello, Terrence.
Hi, John. How are you?
I'm glad to say not in need of medical care whatsoever, NHI, public or private. Do you think it's political, the party political, election-related timing?
In a succinct answer, the answer is yes, John. I think this is not a new concept. The green paper on the NHI came out in 2011, the white paper in 2015. And there's been several engagements. And I spent some time, at least an hour, trying to listen to, as you mentioned, the very grand presentation around the NHI launch and the bill and some of the questions and answers. But the specifics seem to be missing. And that's where the concerns lie.
Yeah, I mean, I don't know whether it's going to work for the government. I don't know whether people who'd been wavering and been uncertain about voting for the ANC will now go, okay, this is what they're promising me. That changes my mind. I'm going to get up in the morning and go and vote ANC. And I don't know whether people who've been wavering and are now hearing the DA and other opposition political parties saying we're going to fight for the right of the healthcare system to be improved in a better way, and we're going to take this to court, and they're going to go, I like that attitude. I'm going to go and vote for that party. Do you think it's going to have any impact on voting choices that people make?
I actually do, John, because the reality is, and I say this respectfully, not every consumer has the time to read the policies, guidelines, and watch his interviews. In principle, I'd like to imagine a South Africa where the wealth of one's wallet doesn't dictate the quality of healthcare, where every citizen has equitable access to care that upholds their dignity and health. But in reality, there is scant detail. Ironically, the white paper, which the preceding document to the bill, had a lot more detail. But the grandiose discussions about the minister, I'm the first one to say, is the private healthcare system, does it have issues? Is there abuse? Is there massive overservicing and abuse of funding? Absolutely. But one of the things the minister brought in his question and answer when he was closing the session just over an hour ago is he said, well, there's about 250 billion, according to his estimation, that's being massively used in the private sector, and there's overservicing and abuse for various institutions, whether it's hospitals or doctors or everyone involved in the private healthcare system, and that needs to be done better. But what's missing in his narrative, and the fallacy that I see in his argument, is that's not government funding. That's private payers paying for private services, and whether it's squandered or not, which I don't condone, is a private matter because it's a self-funding system. What government wants to do is then say, well, we'll take the money that you're paying to your private contributions, put it in a public system, and we will then control and decide. But very much so, as an easy example, I was in a presentation when the minister was present with Professor Bill Shah from Harvard back in 2012, where Bill Shah said, you're building an NHS. An NHS is a regulated system where you tell patients where to go. An NHI means if you're in Alexander in Johannesburg and you break your leg, you have a choice between Alexander Clinic and Santon Mediclinic. Then you go to the choice you want. But at this point, the NHI model lacks the specifics and almost creates the impression that government will prescribe like an NHS where you go.
That's certainly the impression that I have, that I will phone them and say, I've got kidney stones, I need treatment, and they will say, go here. And there will be no choice. If I want treatment, I have to go where they tell me to go. Is there anything in the bill? Because I think some people are criticizing simply because it's an ANC initiative and they can't see any good in anything that the ANC does. But is there anything in it that holds at least a reasonable promise of contributing to better healthcare for the majority of South African citizens who at the moment don't enjoy access to particularly good healthcare?
Yes, it does, John. So in principle, I'm in support of a national health insurance and a national health system. So I'm not opposed to the principle of the system. The problem is, given government's track record with what it's done with the public health system besides everything else, and the lack of specifics of what it intends to do with its resources is where my concern lies. Because there's not enough granular detail of what do healthcare practitioners do? What do hospitals do? What do patients do? Just before this interview, 15 minutes ago, my wife said, so do I cancel our medical aid? And I said, no. She said, but that's what they're saying on the announcements, that the system will, or the perception created is, you're going to replace your medical aid. But then, the Secretary General in Mbalula put out a tweet earlier today where he said, I'm not saying it's going to happen now. It may take 5 to 10 years to implement. And 10 minutes later, he puts on another tweet saying, equitable access starts now. And I'm saying, but those don't gel together.
Yeah, and the Gauteng Premier, Panyaza Lesufi, says that the day after you return us to power, you'll be able to go to a hospital of your choice and get free treatment. And, I mean, how many people are going to do that? I hope people are sensible enough to know that this is an election promise and it doesn't hold any water at all. But, what happens if a couple of thousand people go to private health clinics across Johannesburg and demand free treatment? This is...
Yes.
Do you think that at some point sense will prevail? There's inevitably going to be legal action. I don't know what the result of that legal action or those legal actions will be. But do you think there's a point at which sense might prevail and the government and other stakeholders, the fourth time today I've used the word stakeholders, come together and sort of bash out some kind of compromise which keeps some form of private healthcare, keeps some sort of choice in the healthcare system, but at the same time improves access and quality for those people outside of the current private healthcare system?
Absolutely. I think it's an eventuality that has to happen. Whether that happens meaningfully outside of the court system or within the court system, yet to be told. But what is concerning is you've also got to look at who the other interested parties, because let's be honest, it's not just a political move. There are many, and as in all government decisions across the world, they are what we typically say handlers and motivators who have incentives to get these systems done. So there is talks in the business world of who were the proponents that brought this proposal to government, and there's a lot of circulating documents, that there's specific private interests who wanted a larger piece of the pie to administer the entire health system across the country. There are private health systems that are already purporting unofficially to be the current rollout of an NHI-related system without mentioning names. So these factors need to be kept in mind, that it's not just a party political decision. It's not just an ANC decision per se, but there are many other factors to keep in mind with private interests related to that.
Thank you very much indeed, Professor Terrence Kommal, Professor at Northwest University and CEO of Medical Expert Consulting. Somebody says in a WhatsApp, what will happen to private medical care? Will it be banned? Will companies like Discovery be forced to shut down? It won't be banned, but the range of conditions for which it will be able to offer cover will slowly be shut down. So in the beginning, the range of services that will be offered under the NHI will be very small. Perhaps sort of primary health care stuff that is done by private sector, that medical aids won't be able to cover that anymore. So if you want something that qualifies as primary health care, maybe maternity care, you won't be able to go to a private hospital and have that paid for by a medical aid. You will have to go into the NHI system. And as supposedly the NHI system develops and greater capability is brought into it, so 1 by 1, 10 by 10, the range of medical services that medical aids will be able to cover will reduce until the end, in 10 years' time, the only reason to join to a medical aid will be in order to have cover for a service that isn't provided by the NHI, which will be cosmetic surgery and things like that. So a very, very, very limited range of medical interventions will be able to be covered by medical aids once the NHI reaches full capacity.